Let's go in some kind of suggestions that it makes your consultation easier and more effective. Starting with the office design. So we know that the office design of a aesthetic practice is totally different from medical clinics. So my office, as you can see, it's really looking like an office. Looks more like a home. I remember that when people are coming, sometimes when people come to my clinic, they think it's my home and they want to take off the shoes even. So it's a very nice atmosphere. So they come, they relax, they sit, we talk. My receptionist offer them some tea or coffee and chocolate. So there's some newspaper or brochure and stuff. There's a TV and it's not crowded. There are not many people around them. So I try to make it a very relaxing atmosphere rather than having a very serious medical design. So you have to train your receptionist. Maybe you have to spend time. Maybe you have to send your receptionist to different seminars, webinars, training centers to be proper trained how to manage clients in aesthetic medicine. Because if your receptionist is used to more dealing with the medical patients, they need some proper training from the time that they answer the phones and welcoming the patients when they come to your clinic. Definitely having a very on-time schedule. I know all of us, we have a very busy schedule. I myself, I work in the pain clinic. I had 57 patients booked yesterday. So I was behind. Some of the patients are waiting in the waiting area or in the car now in these days because of the COVID for sometimes 1 or 2 hours. But this is not going to happen in my aesthetic practice. So I try my best to make it very on-time schedule. If I know that a patient is coming for a consultation and they want also treatment, I know I need at least 30 to 45 minutes time. So I'm going to tell my receptionist, don't book them 15 minutes. So be careful that the patient everybody has a busy schedule. They are expecting when they come to aesthetic clinics, they be respected, especially because they pay out of the pocket. Their expectation is much, much higher. So we have a friendly and non-medical atmosphere. We discussed that. So spending time with the patient, that's very important. So this is not a time that you just spend 5 minutes with your patient. I can tell you that I have seen that the days that I have overbooked and they booked me 10, 12 patients in 3 or 4 hours of my aesthetic practice, compared to the time that they booked me 4 or 5 patients, my revenue was even higher when I had 4 or 5 patients. And the reason is very obvious, because I had more time to sit with my patient, listen to their complaint, explain them what my treatment plan is, and they trust me. The time that I have 10, 12 patients, I don't have time to listen to them. I don't have the time really to do a proper assessment. Even my sales and my revenue goes down. And believe me, this happened to me several times. And now I tell my reception, please don't do that. So don't double booking unless there is a patient that comes from a complaint or a concern that I have to see the patient, then it's a different story. But if it's just a regular schedule, not to do that. So sit with the patient, listen to them. Sometimes even small stuff can help you a lot for a proper consultation. If you see a patient has talking about a very important meeting, they have a wedding party, they have something very important in the next few days. And if you don't listen to that, so you're not going to mention to the patient, okay, this is not a good time to do injectables, but there is a risk of bruise, there's a risk of downtime, there's a risk of swelling. If the patient tells you that this is my concern and you don't listen, I just want to do what you want to do, at the end of the day, the patient is not happy. I always ask my patient, okay, after I listen to the patient, I know what the complaint is, which sometimes it's totally different from what you see. The patient might come and the complaint might be something very subtle, something very simple that you even don't see it, but for the patient is important. They might have a tiny wrinkle somewhere in the face that you don't see, but you see a big volume loss in the temple, you see a big volume loss under the eye, but the patient doesn't care, right? So first listen to the patient complaint, see what the expectation is, And then I always ask my patient if it's okay to give additional suggestions. Sometimes people are not looking for additional suggestions, right? If the patient come to you and say, okay, I'm here today for my Botox, I'm in rush, do my Botox, I want to go. I'm not going to waste my patient's time by say, okay, now you have volume loss here and there. They're going to get upset. They are in rush. They want to go. They want to just get a Botox. I can always offer them, if you have another time that you want to come here, I have a good suggestion for you that you can come back. But I'm not going to give them additional suggestion if they're not asking for it. Okay. Treatment plan should be very, very clear. And when I say clear, if you are, for example, making a plan doing injection in 2 or 3 sessions, you have to explain to the patient in advance. You have to tell them why you're doing that. As an example, if you're doing a skin booster and you need skin booster and needs 3 sessions of treatment every 3 weeks, explain to the patient. They have to know clear what is going to be the expectation, because they want to manage their budget, they want to manage their time, they have to manage their schedule, they have to know what the treatment plan is. And again, by making this clear, if you have to, for example, you have to, you know that the patient needs 5 or 6 fillers, but today you want to just to do a 3 syringes of filler, but you know that the patient needs another syringes of filler in the next 2 or 3 weeks, just tell them, because if they don't know that, they will come back after 2 or 3 weeks and they blame you that they do not see any result. But if you tell them that this was just making a base, now I want to see you in 2 or 3 weeks, we're going to inject you more, they will be prepared when they're coming to you. And don't offer the patients that you don't have that treatment. Yes, there are so many treatments for certain complaints. Examples, acne scars. You have so many treatments now in the market. We have ablative laser, non-ablative lasers, chemical peeling, PRP, microneedling, radiofrequencing, with microneedle, without microneedle. But are you offering all of them to the patient? If you don't have it, why you want to waste your time, their time, make your patient very confused? Just offer them the treatment that you have. Okay? And if you think that the patient is a surgical candidate and they're not going to be so much effective with a non-surgical treatment, be honest with your patient. So just tell them that this amount of sagging that I see in your face, you're not going to see a dramatic change with a filler and toxin, so you most probably will need some kind of facelifting surgery or neck lift surgery. Let the patient decide. You will see sometimes patients, they appreciate that, but it will tell you, okay, you know what? I know my face needs a surgery, but I don't have time for surgery. I don't have time for downtime. My expectation, I know exactly that I'm not going to get dramatic change, but my expectation is just a slight refreshment. Can I do it or not? So in this way, treatment plan is clear. Patient understand what the expectation should be, and now ready to go. Right? Definitely stay in the budget. So if the patient tell you that, okay, my budget is $500, $1,000, I cannot spend more than that. It's COVID. I don't have job. I have lost my business. I cannot spend more than that. So don't offer them 5 syringes of filler, because they cannot afford it and they just get frustrated. They're not going to come back to you. So you can just go with the budget. You can just go step by step in your consultations. So we always discussed about the post-op. I highly recommend you to give the patient post-op and follow-up arrangement in written. You can email it. Now these days, this is an electronic day. Not everything should be in paper. You can give either electronic or paper. Let the patient understand what are the post-op, what is the downtime before the patient leave your clinic. And definitely no force for upsell. So all of us wants to have a good business. We wants to make money. There's no doubt. But don't make it in a way that the patient feels that you're forcing for upsells. And I have seen that in some clinics that the consultants that can be a medical statisticians or can be a nurse injector or can be a physician, they are forcing the patient for this and that. And the patient feels overwhelmed. The fact is so forced and pressed and pressure. So that's not a good feeling, and they're not going to come back to you.